Hi, I'm Dr. Natesh, orthopedic surgeon and professor of orthopedics, Virinchi Hospital, Banjara Hills. Today I'm going to speak about avascular necrosis of hip joint. Avascular necrosis of hip joint is a condition wherein the hip joint of the patient uh, undergoes osteoarthritic changes because of the initial problem will be because of loss of blood supply to the head of the femur, wherein the head of the femur will get deformed and deforming the acetabulum as well, and the rubbing surfaces, the articulating surfaces, once they get deformed, they develop osteoarthritis and osteophytes, and that causes severe pain to the patient. This can be handled at two stages. Early stages, this can be handled with core decompression and regrowth technology, or regrowth therapies, or platelet-rich plasma, or BMAC, depending upon the case. And at later stages, when the deformity is very severe, arthritis is very severe, the patient had to undergo total hip replacement surgeries. And these conditions are nowadays increasing because of post-COVID treatments, like with steroids, or with even just the viral infection itself in certain cases is causing avascular necrosis of hip joint. In addition to the COVID pandemic, the other causes, other reasons that can cause avascular necrosis of hip joint are excessive steroid usage, like patients with diabetes or some skin allergies who are on steroids for a long time, or patients who are having alcoholic issues, habit forming habits, or smoking habit. They are also at very high risk of developing avascular necrosis of hip joint. So my suggestion to everybody is that if you are having any pain in the hip joint, and especially if the pain in the hip joint is associated with reduction in range of motion of the hip joint, and standing for a long time is causing some pain in your hip, then please get your hip verified, and your orthopedician may advise X-ray or an MRI scan, which will diagnose the condition of the head of the femur, and you can definitely avoid a total hip replacement surgery with initial diagnosis and early treatment. Thank you.